set. Good afternoon, everyone. I'm New York State Attorney General Eric Schneiderman, and I thank you for joining me here today. Unfortunately, we are here to talk about yet another reckless and cruel decision by the Trump administration that puts the health and the lives of New Yorkers and families all across America at risk. I'm pleased to be joined by some of my key attorneys in my office and by one of our great allies and a leader in New York's healthcare community, Laura Alfredo of the Greater New York Hospitals Association, and from my office, Lisa Landau, Eric Herron, and Stephen Wu, who are part of the team that will be defending the healthcare system that so many Americans have come to depend on. Late last night, President Trump announced that he would cut off vital subsidies that help make health care affordable to everyday New Yorkers and millions of low-income Americans across the country. His move is unacceptable, it's cruel, and it is unlawful. That is why today we are filing a multi-state lawsuit to protect New Yorkers and all Americans' access to quality, affordable health care. This past summer, the highest court that has yet considered this issue, the Court of Appeals for the District of Columbia, granted a motion by our coalition of attorneys general to intervene in a case pending in Washington, House v. Price, to defend these cost-sharing subsidies and the quality, affordable health care they ensure for millions of families across the country. These cost-sharing subsidies are crucial to the functioning of healthcare markets in our state and in every state. These subsidies make healthcare affordable for thousands of New Yorkers and millions of Americans, and we made it clear this summer that we would fight to protect them. And in granting our motion to intervene, the court recognized that they could no longer rely on the Trump administration to provide proper defense for the Affordable Care Act. We are now in a position to defend that. In fact, in its opinion in August granting our motion to intervene, the Court of Appeals for the D.C. Circuit explicitly noted that the cuts to cost-sharing reduction payments that Trump just announced yesterday would have a devastating impact on states across America. The court wrote that the states had shown that, quote, termination of the payments at issue here would lead directly and imminently to an increase in insurance prices, which in turn will increase the number of uninsured individuals for whom the state will have to provide health care. So that's not just me saying that Trump's move will drive up insurance prices and increase the number of uninsureds. That has been recognized by the court that heard this case in August. It will be recognized by other courts as we anticipate other complaints being filed in litigation across the country on this issue. So given all of this, given the recognition by all responsible parties of the devastating consequences of this move, his effort to gut these subsidies with no warning or even a plan to contain the fallout is breathtakingly reckless. He has failed twice in efforts to legislatively repeal and replace the Affordable Care Act. This is an effort simply to blow up the system. We will not allow President Trump to use New York families as political pawns in his dangerous partisan campaign to sabotage our healthcare system. The heart of our argument is really very, very simple. The Affordable Care Act is the law of the land. It has been challenged and upheld. And the cost-sharing reduction payments that he would eliminate are an integral part of the system created under the ACA. There is a permanent appropriation provided for tax credits under the ACA, and the cost-sharing reduction payments are paid based on the eligibility for tax credits. They must be preserved as an integral part of this system. And since the Affordable Care Act became law, we've been able to reduce the number of uninsured New Yorkers by half. We've set up one of the best healthcare exchanges in the country. And again, our system and the system in every state relies on the cost-sharing reduction payments to make the system work and to ensure that lower-income people eligible for this are between 100% and 250% of the poverty rate, are able to get health insurance. These are regular working people who don't care about the political games in Washington. The decision by President Trump threatens them in a very real way, and people are scared. People with pre-existing conditions like cancer or diabetes, people in nursing homes People with opioid addiction who desperately need treatment, they suddenly have a horrifying and completely avoidable fear that they will lose their health care or that it will become unaffordable. With this move, President Trump has taken his threats off of Twitter and brought them into the living rooms of working families across America and the offices of America's doctors, nurses, and other healthcare providers. He said himself that he wanted to see Obamacare explode. Well, this is an effort to blow it up, and we're not going to let him do it. The subsidies he is ordered to cut are required by the Affordable Care Act, which is still the law of the land. He can't simply refuse to pay them, and we will be in court to defend these subsidies and fight his dangerous decision with everything we've got. So I do have a very simple message for all of the millions of Americans who woke up this morning scared about what the future holds for themselves and their families. We have your back. We will fight for you as long as it takes, and we will never let President Trump's short-sightedness and cruelty win. And our message to the president is equally simple. Once again, we will see you in court. And now we're going to hear a little from a great colleague and a representative of the incredible healthcare sector in New York that is such an important part of our economy and our civic life, and very much put at risk by the president's efforts to undermine the Affordable Care Act that he made yesterday. Laura.
Thank you. Good afternoon. Once again, the Greater New York Hospital Association and our members stand with Attorney General Schneiderman and his excellent team of lawyers in protecting New Yorkers' rights to access health care. As our President Ken Rasky said this morning, this latest action is yet another attack on the values of the healthcare community, which are to provide care to every New Yorker. We've made great strides under the Affordable Care Act. As the Attorney General said, we've reduced the uninsured rate by about half. We've seen more people with coverage coming in to get more care. They're healthier, they're getting preventive care, they're getting care that they need, and it's our privilege to help them and take care of them. The Essential Plan was a big part of that story, and this latest action really serves to undermine the effectiveness of that plan. It will result in about a $870 million hole in funding for the program, putting New York State in basically an untenable position of having to find the funds to make up for it. We can't go backwards, and so the Greater New York Hospital Association and our members, the hospitals of New York, the nurses, the doctors, and all of the people who care for the patients of New York, including in some of the most underserved rural and urban environments in the state, stand with the Attorney General. We thank you very much for your leadership, and we're here to help you every step of the way.
Thank you. Thank you. And I do also want to emphasize that we are also supported in this effort by SU 1199, our friends there. You may recall that when there was an earlier threat to repeal the Affordable Care Act, we had a rally which with the governor and others from the healthcare industry. Business, labor, government are all united in New York. We will defend the healthcare system. We should be expanding and fixing and improving on the work of the Affordable Care Act. That's what the overwhelming majority of New Yorkers want, the overwhelming majority of Americans want. That's what our business community wants. That's what the labor movement wants. This is something on which there is extraordinary unity, and we are not going to let the president destroy a system that is providing for so many of our people. So with that, if you have questions on topic, you could direct them to Amy.
Yeah, if I'm not mistaken, one of the arguments about this that Republicans have made in the past is that only Congress controls the purse strings, and only Congress can say we're going to spend that. Do you address that, and is that an issue?
Yes, yes, and it is very important to recognize that in the case, which I note that Attorney General Sessions, in his letter on which the president is using as justification for this, does cite the district court decision in House v. Price, which is the case that the House Republicans brought in order to attack the Affordable Care Act and the cost-sharing subsidies. He does not mentioned the fact that the D.C. Court of Appeals has also allowed us to intervene in recognition of the weakness of their position. The argument is very simple. There is a permanent appropriation provided for that was added to a different part of the federal law by the Affordable Care Act, and it is explicitly a permanent appropriation to pay for tax credits and expenses of the Affordable Care Act. So our position is that that is enough congressional action to justify this. The cost-sharing reduction payments are really you can only get them if you're applying for tax credit. So it's almost like saying there's an appropriation for the car and the wheels come along with the car. So they're making an argument that you have to have separate specific language for this one particular set of credits. We say that's not true, and we feel very strongly that that argument should prevail. Congress passed the Affordable Care Act. It has been challenged. It has been upheld. It is the law. These payments are integral to it. The courts do not read congressional action, if they can avoid it, to create chaos or have a system that becomes dysfunctional, and the system would become dysfunctional if this portion of it is taken out. And I also note that for whatever reason, the president has continued to make the payments of these cost-sharing reduction payments monthly during the pendency of this. Why all of a sudden he gets a letter from Jeff Sessions saying, whoa, we've just figured out that this is improper and illegal, and then he decides he's going to kill it. I think that has more to do with politics, his frustration at their inability to actually do what they should do, which is take congressional action to improve health care and access to health care in America, and whatever other motivations he may have related to the events of the week.
Roger Stern, 1010 wins. First of all, how many states are with you as part of this, and is this a new action, or this is, you're talking about the action that was launched a while ago?
Well, we do anticipate that there will be multiple complaints filed. Today, a complaint is being filed in the Northern District of California. Together, New York, California, Massachusetts, and about at least a dozen other states are going to be in that action. We also lead a coalition of 17 states and the District of Columbia in the House v. Price litigation. That case has currently been held in abeyance by the Court of Appeals, so we do anticipate proceeding with litigation there also, but the fast track for initial relief will be in the case we're filing in California. But I do anticipate there will be other complaints filed, and at some point there may be an effort to consolidate them. We're going to be fighting on every front.
Thank you. Alejandro Rincon with NTN24. I want to follow up on the concern about the deadline. And Trump administration has said that the next payment that is due next Wednesday is pretty much not going to happen. So is there going to be any urgent action to actually make it happen, or which is the way forward?
Yeah, the way forward is for us to seek emergency relief, and we will be doing that. Yes, absolutely. We're very conscious of the deadline. I'm sorry, speak. Well, we are going to be speaking through our papers in court, and again, the unity of opposition to this reckless, cruel move, the insurance industry, the healthcare industry, healthcare workers, consumers, government, we all recognize that this is a dangerous move. We want to provide assurance for the insurers that these cost-sharing reduction payments will continue. He has already succeeded in scaring them. Now, some states have taken into account the possibility that this would happen in setting our rates for the coming year. New York, we had the wisdom to take that into account. So it's going to have an uneven effect from state to state. But the long-term effect is absolutely clear, and that's why I read the language from the Court of Appeals. It is clear that this will drive up insurance costs. It will increase the number of uninsured. People who are sick will not get treatment. People will suffer, and people will die.
Christian Benavides from Telemundo. So the main argument, so just so that I understand, is that the law says that they have to make those payments. That's what you guys are going to argue for.
Correct. Their law says they have to make the payments, and they have had a very technical argument that there should be even though there is an appropriation for the Affordable Care Act, there should be separate language for this very specific provision. We say that that's not true, and then that's the fight. But it is absolutely clear that the Affordable Care Act was designed as a comprehensive system. It's got a lot of checks and balances, and there are ways in which some of us support actually making it stronger and improving on it. But to single out the cost-sharing reduction payments is to take a key piece out of the entire system that will make the whole system fall apart. So this is something that clearly would not have been what Congress intended when they passed the Affordable Care Act, because they didn't intend to create a system that wouldn't function. And the balance that was struck required these cost-sharing reduction payments in order to make co-pays affordable and deductibles affordable. This is a critical part of the system, and without it, millions of families across America will suffer.
And do you have an approximate number of how many New Yorkers would be impacted?
Immediately, not that many, but ultimately millions. I mean, this is something that again, there is not any dispute by any responsible party. I think the Congressional Budget Office, in an earlier effort to take away the cost-sharing subsidies, estimated that this will massively increase the federal deficit. I mean, this is just a bad move in terms of every aspect of public policy. So yes, this would affect, this would blow up the healthcare system. Again, the president and the Republicans in Congress have tried and failed to repeal and replace the Affordable Care Act because it is so popular with their own constituents. This is an backhanded effort to go around the congressional process and undermine this healthcare law that millions and millions of people have come to depend on.
You've been here before, announcing various lawsuits against this president on a variety of issues. What do you think is driving it?
It doesn't appear to be rational public policy analysis, that's for sure. I mean, look, we have challenged them, and I'm very proud of the work our coalition of attorneys general has done. We've challenged him on his first and his second anti-Muslim travel bans. We've challenged actions by the Environmental Protection Agency and Department of Energy and beaten him when they've tried to dial back rules on smog pollution and methane. So there seems to be a kind of a knee-jerk desire to undo whatever they associate with President Obama. And the fact of the matter is the overwhelming majority of the American people think we should improve on and build on the Affordable Care Act and make it stronger, not weaker. So the calculus seems to be driven by animus towards his predecessor and by a very, very out of touch with reality ideology. It is certainly not based on any empirical evidence or proper analysis of healthcare or economics or the good of the American people. Thank you all.
Different topic. Taking questions.
We'll take one.
Um,
Can't imagine what that would be.
Do you expect to investigate or have others investigate Mr. Vance's activities vis-a-vis the Trump kids and Mr. Weinstein?
First of all, whatever the issues are related to Mr. Weinstein, the allegations that have come out in recent days are horrendous and despicable, and that goes without saying. I have known Cy Vance for a very long time before either of us had these jobs. We were on a sentencing commission together, and I've always found him in his dealings with me to act with utter integrity. Thank you.